This is Erin and Stephanie from Wake Forest University, and this is our nutrition project about dehydration. Water is critical for the body to function properly. If we do not hydrate ourselves with water, our body is unable to perform normal bodily functions. Most of the water inside our bodies is found in the intracellular space. However, some water is found in the blood vessels, or the intravascular space. The rest is found in the space between the cells. That being said, water is a large part of our body. In fact, it makes up 75% of our total body weight. If we do not drink enough water to maintain proper functioning, we become dehydrated. Dehydration occurs when the amount of water leaving our bodies exceeds the amount of water our bodies take in. The first step in preventing dehydration is drinking the right amount of fluids in conjunction with the climate and your activity level, body weight, and gender. The average adult should consume 1/2 their body weight in ounces of water, or roughly 2 or 3 liters of water a day. Your thirst mechanism reminds you to drink water due to loss of water during normal bodily function. There are many reasons why we lose water. When we breathe, sometimes oxygen and water leave our bodies through humidified air. Another way we lose water is through sweating. When our body tries to retain its homeostasis during exercise, hot weather, or when it is fighting an infection, we sweat to cool our body temperature and lose water in the process. Also, when our body gets rid of waste products, we lose water through urine, bowel movements, or even vomiting. Some side effects of dehydration include lightheadedness, shock, rapid heartbeat, delayed capillary refill, and muscle cramps. Before these kick in, your body may warn you again to rehydrate by drying your mouth, eyes, and skin and decreasing your sweat and urine output. To make sure you are hydrated at all times, check the dryness of your mouth. If it is not a little wet, your body is not only dehydrated, but extremely dehydrated. If your body has lost 2% of its body weight due to water loss, significant dehydration effects will occur. Next, we will discuss the physiological effects and coping mechanisms of dehydration in the nervous and cardiac systems. Body becomes severely dehydrated, your body's coping mechanisms attempt to preserve physiological functioning. Initial dehydration lowers your blood pressure. Through the activation of coping mechanisms, your body will attempt to restore its normal blood pressure. It will do this by increasing your heart rate and constricting blood vessels. If there is a decrease in blood volume caused by dehydration, your body will take water from the surrounding cells and move it into the blood vessels. This regulation, however, is short-term. Dehydration affects the cardiovascular system first by causing an increased heart rate and/or an irregular heartbeat. This makes a dehydrated person more susceptible to cardiac collapse as the irregular heartbeat causes blood pressure to decrease. During this process, a person may feel weak or dizzy. Dehydration affects the nervous system by causing less blood circulation to the brain and body. In extreme cases, coma, organ failure, and death may occur due to the death of brain cells. When someone is examined for dehydration, examinations check a person's mental capabilities. These exams include testing alertness and vital signs. A person's blood pressure, temperature, and skin condition is also tested because skin loses water and becomes elastic when a person is dehydrated. Blood tests are conducted to determine electrolyte imbalance. Lastly, a person's concentration of urine is examined. Some fluid replacement by mouth or intravenous fluid, in other words, through an IV, is critical. If dehydration occurs over a long period of time, a person can be treated at home if symptoms are caught and treated early enough. If someone experiences diarrhea or vomiting onset by dehydration, a person should adhere to the Bratz diet, which consists of bananas, rice, applesauce, and toast. Medications may also be used to control diarrhea and vomiting and therefore lessen the amount of water lost. If someone experiences confusion or lethargy, they should seek medical attention right away. Complications that result from severe or chronic dehydration include Complications that result from severe or chronic dehydration include kidney failure, coma, shock, heat-related illnesses, and electrolyte imbalances. Kidney failure is common and reversible. As a person becomes more dehydrated, the intravascular fluid's volume decreases and their blood pressure drops. In turn, this causes a decrease of blood flow to the kidneys, which decreases the kidney's ability to function properly. As discussed earlier, a decreased blood supply to the brain can cause confusion and even lead to comas. A person goes into shock because the blood flow and oxygen are not sufficiently delivered to the body's vital organs. This causes organs and cells to malfunction. A person can also experience heat-related illnesses and associated complications due to dehydration. This occurs when the body tries to cool itself by sweat and the muscle spasm, which can lead to heat cramps. Heat stroke and heat exhaustion can also occur from dehydration. A person's electrolytes can become imbalanced due to dehydration. This occurs because vital electrolytes, like sodium and potassium, are lost when a person sweats. This can cause heart rhythm disturbances, muscle weaknesses, and even on average, recovering from mild dehydration takes about 3 days. In these 3 days, the body has to redistribute electrolytes to different spaces in the body. If someone is not treated soon enough, a person may remain hypotensive and in shock for too long. If a person is overtreated too soon, cells may swell and die due to negative effects on the water and electrolyte concentrations in their body. Preventing dehydration may seem simple. However, there are many reasons why people do not take in the right amount of fluids that their bodies need. A person's climate, daily activities, and exercise should be taken into consideration when they are attempting to prevent dehydration. During exercise, your body requires more water for proper functioning and cooling, and thus, you need to increase your water intake. It is recommended that people exercise in the early morning or evening, when the weather is cooler. A person should avoid exercising and labor-intensive work during the hottest part of the day, which is around noon. If you have to work or exercise during this time, find shade as much as possible and drink plenty of water and drinks with electrolytes. This graph shows the amount of dehydrated high school athletes in different months of the year. As you can see, in August there is a dramatic increase in the number of dehydration cases that are related to heat. The young and the elderly are especially at risk for dehydration, so more care should be taken to ensure that they are receiving adequate amounts of water. Caffeine, which can be found in coffee, tea, soft drinks, chocolate, and even some nuts, have a dehydrating effect on the body due to an increase in blood flow to the kidneys and thus frequent urination. Alcohol also has a dehydrating effect on the body. Alcohol, however, also attacks our body's stores of potassium, which result in thirst, muscle cramps, dizziness, and although drinking water is the best way to hydrate your body, you can also hydrate yourself with food sources. Fruits and vegetables, such as watermelons and celery, are good sources of water. Meat may be made up of about 60% of water as well. Examples of good sources of water found in food include soups, broths, chicken breasts, hamburgers, grapes, fruit juices, and smoothies. As you can see, water is essential for all bodily functions, so it's important to keep yourself hydrated. Dehydration can lead to major and minor health problems, especially in warmer temperatures, so it's important